Welcome, everybody. Welcome to another episode of the GeekyAnts Podcast. We have a very special guest with us today. We have been working on the healthcare industry for quite some time. We have many engineers who have been experimenting, doing a lot of R&D in healthcare. And as you know, healthcare is one of the most trending topics in the industry right now. A lot of things to uncover, especially with AI coming in and with the current disruptions happening in AI. And for that, we have Manav Goyal. He is Principal Technical Consultant at GeekyAnts, leading the healthcare program. Welcome, Manav, to the show.
Thanks, Rakesh. Thanks for having me here.
Yes, fantastic. So, Manav, I think we'll just have a very general conversation first before we dive into the actual nitty-gritties of things. I have a few curveballs for you, so you'll enjoy that, I believe.
Yeah. It's
Okay.
super exciting to be here.
Great, fantastic. So Manav, let's start with the overall, state of the industry at the moment. What is your outlook on the industry of the healthcare industry in general, and where things are moving? What's your thoughts on that?
Well, it's getting exciting by the day, and with innovations in AI, it has given a boost to healthcare. Obviously, in every other segment there is a boost,
Yeah.
but with AI in healthcare, there are a lot of things changing. So I just ran a study for medical devices, right? The FDA and, from US government have increased the number of approvals for the medical devices, AI enabled medical devices in recent years. I mean, it's the first AI enabled device was recorded or approved back in 1995. But as we had innovations in AI, in 2015 that number increased up to 6, and recently in 2023 there were roughly around more than 200 devices which were approved by the FDA. So this shows how eager even the government backing is for approving those and giving that bandwidth to developers and everyone, even healthcare providers, to include those into the ecosystem and get that boost.
Interesting. So when you say wearable devices, right, is there like a specific category of wearable devices, or is there just one category that's getting all the attention?
Well, yes, that's a very good question. It's not only about wearable devices in general, it's about medical devices. So there is a kind of difference in that fraction. Medical devices are more which are utilized by people in the healthcare setups and obviously in their homes. So for example, I'll give you an example like ventilators or oximeters, or you have like glucose meters.
Yeah.
So those things fall under the medical devices section, and there is a lot of AI integrations happening in those, utilizing the sensors and everything, right? And wearables is a fragment of those. If we can just call that as a fragment,
Okay.
which includes the AI element but not necessarily is linked with a lot of health data. It's about fitness, wellness, and basic vitals data, but not in the proper setup. Right?
Okay. Yeah.
So
It's not
if I talk,
qualitative database in general, right?
yes.
Okay.
So if I talk about where that segment is much more boomed up, I would say it's started with the radiology section a bit more, right? Radiology means wherever you are doing those ultrasounds, those scannings, those investigations, there the AI boom was the maximum.
Okay.
Right? And those were the maximum number of devices that also saw approvals from FDAs. Why include that? See, what I feel is that in those areas, a lot of documentation and investigation process goes in, and there also lies an opportunity for removing repetitive tasks. Right? So you can utilize AI more there in terms of analyzing the data, getting out results from that, streaming that data directly to the healthcare providers to improvise and speed fast the process, and also to ramp up the investigation. As in, I'll give you an example. In 2022, Apple got that arterial fibrillation, right? And that helped them predict cardiac arrhythmia, which was really good. I mean, they improvised on it into the years, but in 2022 they started that. And I read a news also which said that a person who was utilizing Apple Health, they got a kind of notification and it helped them save their life. So which is beautiful. right? So those are like some areas where all of those investigations were held, and that's why like the radiology was the first department, I would say, in the entire healthcare ecosystem where this got much more traction. Obviously, it is now like every other department are learning from those and like improvising onto those stuff now.
So basically, you're saying that any department that has a lot of repetitive tasks that can be analyzed by AI will naturally gravitate towards that particular domain, right?
Exactly.
Of it, right. Interesting. So, are there not any risk factors there? See, a radiology data or a report is very, very personal as well as very, very crucial for that particular patient.
Yes.
It's also very different.
Yes.
There are certain nuances to every reading.
Yes.
Is AI at the moment smart enough that it can detect those nuances?
See, risk considerations are always there, and whenever you are including like automation or bots to do the work of humans,
Expert humans, doctors, well-trained doctors.
trained doctors,
Yes.
so obviously there will be risk factors, and that is why a lot of training and boundaries needs to be set while utilizing
For the models.
for the models. Yes.
Okay.
Wherever we are kind of utilizing GenAI, obviously there are segments in if we talk specifically about radiology, there are segments where GenAI would not be that much utilized, rather than the AI capabilities of investigations and image like reconciliations and all of those pieces will be utilized, right?
Right.
But when it comes to GenAI, then the risk factors increases, because that is something which is like the talk of the town right now, right? And when I mentioned about the AI enabled devices, none of them which is approved by the FDA lies in the scope of GenAI at this moment.
Okay, very interesting. So I think when people, like in general, right, everybody who is not deep into the AI game, when they say AI, they mean Gen AI. ChatGPT is their default AI benchmark, right?
Yes.
So for everybody who's listening in general, right, let's define those. Could you help define when you say AI in healthcare, what does it mean? What is the type of AI you're referring to?
Like there are, as I mentioned, there are segments, right? If I talk about like the general term which everyone like relates with, which is ChatGPT, that is Gen AI,
Right.
generative AI, which helps you chat with the system, provide your prompts, like work onto those, good for editing, chatting, getting information, automating like repetitive tasks and everything.
That's not the FDA approved one.
No, those things are not something which is like that is a different scope. So when I talked about like the AI enabled machines, right? When I talked about ventilators, when I talk about oximeters,
in general.
yes, in those the AI capabilities are quite different, right? These are just tools that we are talking about, right? To like scope out work or help as an assistant or something.
Interesting, very interesting. Could you tell me, like, I'm interested to know now, what are the experiments or what are the research projects that you're working on in general in this area, right? And if there are any big challenges you are facing,
Sure.
what are those?
Sure. See, a very interesting experimentation that we recently worked upon was to, provide a mechanism for personalized care. So this is a very interesting
Personalized gear.
care. Personalized.
Personalized care. Okay.
Yeah.
Care.
This is a really interesting topic to ponder on. So like nowadays, the problem that I see is that healthcare providers and patients, these are the two major stakeholders that lie in this healthcare domain, right? And the model with a physical consultation or a teleconsultation would be a one-to-one model, right? So if we provide ways to convert that into one-to-many model, then it auto scales and it helps to provide that care at a larger scale. Do you get my point?
Can you explain one to many though?
Yeah.
One to one is very clear.
Yes.
You get on a call with a doctor, you chat with them, you show them what your where your ailments are, you tell them your symptoms. That's very clear. What do you mean by one to many?
So by one to many, it's more like, let's just say that both of us are facing the same problem.
Interesting. Okay.
Right. And we need to refer to some like guidelines maybe. And rather than both of us going to the doctor for separate consultations, we have a medical database that has, experts insights, that has our vitals and whatever not, and it provides us like that personalized advice or personalized guidance based upon the accurate medical data that is being referenced. And see, the challenge lies there, because how would you say that how much accurate that reference, that knowledge
question in my mind. Yeah.
Yes, exactly. So that's a very tricky part, and when working with that, it needs regular audits, regular updates, and it has to be as much relevant and accurate as much possible. Obviously, it cannot match the healthcare professional, right? And we need to have that kind of edge with us, that we don't overdo things and do not suggest, even in our experiment, what we have done is we have kind of created those boundaries for the GenAI to not directly give medical advices to people, even if they are taking in those medical references, which we have vetted from healthcare professionals, right? So that our suggestions becomes more accurate, and rather than the AI hallucinating things. So, but even then, what we have done is that we have created a boundary not to give specific or direct advices, rather focus on medical guidance, so that in the first go, when the user is kind of self-managing, because in one-to-many, it's more like you necessarily don't go for a consultation in the first go.
Yeah.
In the first go, obviously, if the ailment increases, or if that is something serious that you need to visit a doctor, which the AI cannot give you relevant answers for, then obviously that is something, even in our experiment, we suggest that for this, just go ahead and consult a doctor.
Okay.
But in the initial phases, this can be given to the users to self-manage themselves. Like for very basics, like for example, we both are working on our health transformation. Right? This is something which would not necessarily require you to have too many one-to-one interactions with your healthcare provider, right? Because this is kind of a daily thing that a person needs to do.
And it's kind of like very standard to a certain point.
Yeah, I mean, we have reached those standards. Obviously, there are innovations happening in those industry as well. But if we keep a mindful of those innovations, add that to our knowledge base, and then try to provide those kind of personalized plans and actions to the user, then it becomes really easy. Like I mentioned an example of health transformation, right? So let's just say both of us, or let's just say 10 and 20 people like us are focusing on to health transformation with somewhat different goals. Right? Goals can be different, like you want to be fit, you want to reduce fat, you want to increase muscle mass, whatever, right? And based upon that, it's not necessary that you are consulting doctors on one-to-one basis, but you do require medical guidance, right? While doing while transforming your journey. So in those scenarios, it becomes really easy, and that is the whole point of our experiment also, that we have started in this fitness piece, wherein we kind of take the profile information of the user, create a personalized objects or persona, I would say, and feed that into the model. And whenever the user registers, we provide those along with the vitals and everything, if that has been integrated, and that utilizing that, we try to create a personalized healthcare plan for them, which they can use to self-manage. Now they don't need a specific healthcare professional to sit with them and take care of this journey, but rather they self-manage. So what benefits it provides is that it gives you freedom, and it gives you a next level of engagement as well, because now it is being managed by oneself. Right? And to keep up that engagement, what we also added in the experiment was what's the way to hook them, right?
Okay.
It's a general market practicing.
Yeah.
Right? We need them to come back, and we need them to
keep on using
the app, and also
yeah.
a healthcare transformation journey requires consistency rather than peaks. Right? And for that consistency, what you really require is that daily they are able to do those things as per the plan.
Okay.
So how do you bring back, how do you make them do all of those things?
Right. So I think it's very disruptive for the fitness industry in general, correct? What you are suggesting right now.
Yes, exactly. Okay. So I mean, it can be leveraged up to any levels, but this is just an experiment that we were trying.
Interesting. I'm also thinking your sample size will be very important in this. The bigger your sample size, the better your results are. Are you able to get the sample size at the moment? Are you able to hit those sample size numbers, or are you training them on an iterative model? What's your process?
Obviously, iterative models, and we are also kind of limiting the audience that we are doing that for, because those healthcare transformations can be for anyone, right? Even a pregnant woman after delivery can utilize those things.
Right.
Even old age people can utilize those things. So we are kind of targeting audiences and like retraining our models utilizing the retrieval augmented generation technique, so that it becomes as much accurate, and we like, it's, as you mentioned, it's iterative, and initial results were like not really good.
Bad. Okay.
They were not really good, and what we utilized for models was AWS Bedrock technology.
Okay.
And we tried on different models so that we can understand which one is giving us much more much more relative data to that healthcare. So we tried Claude Sonnet, we tried ChatGPT Turbo, we tried Amazon Titan. So there are the things that we tried, right? And out of these, I think ChatGPT Turbo was giving somewhat good results to us. But again, I mean, we are iterating over those so that we try to give the best possible, references.
Great. So I think like what you are now referring to is kind of also like a pre-screening for hospitals, right? Whether is that is it correct? What I'm understanding, let's say someone is sick, and hospitals have this tool or app on the platform. They come to the tool, they go to the website, and they have a certain set of questions, and they suggest whether they need to see a doctor, they do not need to see a doctor, or whether they still want to see a doctor. Is that a use case that I'm looking at? That's just something that is in my head at the moment.
I know that's a really interesting topic that you have put up. So it's another usage of like this platform that we can do. And pre-screening is a kind of a very important step right now. It does happen in today's world as well.
Okay.
It does happen, but it's not kind of it's like a predefined set of questions that we give to the
What's your weight? What's the BP? What's your
exactly what issues,
medication?
any prescriptions that you are taking. So even if you book a appointment right now with like big hospitals like Apollo hospitals, I just visited that last week, and I was going in for let's just say I was going for a dermatology appointment.
You didn't just go for taking a use case study, right?
Yeah,
just to experiment.
No. I'm just mentioning what was the process that I followed.
Okay.
Right? So I had to fill up that entire form, give them the initial data and everything. But again, those can be improvised with personalized data, right? Because this is something that they will be utilizing on daily basis, and it takes in their regular data. For example, I'll tell you, the wearables that we have right now. So they track our like heart rate variations. They track our sleep disruptions, if any. So it gives you kind of a like data over a period, which is gold, right?
Yes.
Data is gold right now. So if you comprise all of that and try to put into like these like transform that into these models and give actionable insights to the healthcare professionals before that actual consultation happens, then it kind of increases or maybe improves the process of investigation. So that is a very good application of.
Do you predict a future where a doctor will ask you that what is your Apple Watch reading or what is your smartwatch reading?
Not really, but see, these are some things that might help, I would say,
because it's going to have the data, right? Let's say I'm wearing this watch.
Yes.
For let's say 18 to 19 hours a day.
Yeah.
Even sometimes when I sleep, right? So in that condition, when I'm wearing this watch so much, it gives you all the spikes in my heart rate, my walking steps, how much steps I've walked, what is the number of stairs I've climbed, am I breathing more heavy when I'm climbing those stairs? So isn't that like very golden data, and should doctors not be looking at it?
It is, and I think they do look at it.
Okay.
Not in I would say specific terms right now because of all of the challenges that you have mentioned.
Right.
But those data are quite relevant for users and for both healthcare providers.
And the more accurate it becomes, the more relevant it's going to become for the doctor. Okay, great, fantastic. So, but the question still remains, right? Ethical considerations. How much do you actually track? Where do you stand on this?
Well, see, anywhere we deal with patient data, it becomes our ethical responsibility to take measures which upholds their privacy.
Right.
That is a major concern when it comes to like feeding all of, like you mentioned, you are wearing that watch for 18, 19 hours a day.
Yes.
So that is kind of your personalized data that you are referring or giving out to these platforms.
Correct.
Right. And what I'm talking about is utilizing that data to a whole new level. So
Correct.
it should be
Across hospitals,
across
networks.
or however we want to utilize to benefit you.
Mm-hmm.
Right. But it has to be utilized in a protected manner so that your privacy doesn't get affected. So that is one ethical factor that we have to consider.
Does the technology exist to achieve that?
Yeah, very much. Yes, it does exist. And even in our experiment, we have tried to mask all of the sensitive data that we are utilizing before sending it to LLMs. Because see, LLMs are right now both open source, in-premise and everything. For this one, we utilized, as I mentioned, AWS Bedrock. So this was kind of an open source model. So if I feed your data directly into the LLM, that becomes a breach of privacy.
Breach of privacy, yeah.
Yeah. So we have to mask that data and remove or hide your personal information so that it doesn't get tracked back to you and still generate those accurate results. This is one way. Other thing that we need to take care is of before passing to the LLM, I need to also create the database with me. I need to store that data in within my ecosystem. There also, it's my ethical responsibility that I encrypt that data and then store it with me rather than because it can lead to any kind of ransomware attack, any kind of cyber attack. So these are some topics that are again really in talk right now because with the usages of these data, the sense of security and a lapse of maybe security comes in.
Okay.
So
I think it's very relevant at the moment because everybody wants to build a device, an application, a chatbot, or even an assistant in any domain, right? But when you're in the healthcare domain and somebody wants to build any of these platforms or devices, anybody who's looking to build them, what would be your advice to them on certain key things that they should note when choosing their partner who builds this platform for them? What would you tell them that this is how you should decide that this is the company or this is the partner I need to go with?
Perfect. That's a really good question. If I think about it, there are multiple segments that pops up in my mind. One is, as we were talking about security. Security and privacy is a major thing that we should consider. Whether and how do we really say that a tech partner is managing your data securely? So there has to be some metrics attached to it so that I can really comment onto those or track those, right? So one of the we can utilize compliances. In US region, it's very strict. We are following HIPAA compliances there. So any tech company that deals with healthcare data, they need to be HIPAA compliant. And under HIPAA compliant, there are specific rules and regulations laid down for data privacy, data security that needs to be followed. A very good example would be if even as a user you are utilizing such kind of an app, then you provide them multi-factor authentications, you provide them TLS encryption. So all of those things are to be integrated while building that app from the scratch.
Okay.
So one thing is that you can have compliances. Other thing would be how much ethical considerations that a particular tech partner is kind of following. So there are policies that needs to be listed down for the tech partners that they follow while dealing with any kind of healthcare engagement. And in that it covers when I talk about ethical consideration, one thing comes to my mind is medical accuracy, right?
Accuracy of the medical data or
accuracy of the suggestions that you are providing.
the suggestion. Okay.
Right, how you are utilizing that data and what are the results, how accurate are those. So for that this needs to be considered that discriminations are not done, right? Based upon, there are many discriminations that can happen based of health data, right? There can be racial discriminations, there can be ethnicity discrimination.
Bias can come in.
Medical AI bias can come.
AI bias can come in.
So those things needs to be taken care of. Even hallucinations affect the results a lot, right? We need to trim down and we need to set boundaries onto how that particular data is ingested, transformed, utilized, and presented back to the user. Because see, AI right now, GenAI is what? It's a tool, it's an assistant. It will work on things that you tell it, right? It's not going to have that context set by itself. So it's your ethical responsibility that you set the context in the right way and do not let it go out of the scope, right? That is one that can be considered. Other thing is obviously the AI working capabilities of the organization. The skill set, yes, they have a relevant skill set to kind of understand where that particular technology is required, right? For example, in a recent conversation with our one of the prospects, they wanted to utilize they were in the in the cosmetics industry, right? And they wanted to utilize AI in terms of having virtual try-ons and an interactive website that gives the kind of boost to their market. So those skill sets are really important when you are judging whether you would want to go to a partner that actually has that capability or not.
To execute the vision that you have.
Execute
the vision. Okay, makes sense. So, final questions before we wind up. What's your 3 key predictions for a future where I believe that AI will be everywhere? It's there.
It's there already.
We cannot ignore it at the moment. It's not anything to anymore. Um, what's your key predictions? Is when will the healthcare industry have its open AI chat GPT moment? Because I still believe it's still in its initial stages, even though a lot of work has gone on, but it's not mainstream still. I still need to go to a hospital and fill out a big 3-pager form before I can
I think we are getting there. And as you mentioned, see, GenAI is something which is not being backed right now. So that's why the number of it totally the market shift depends upon what kind of investments are pouring in for that particular industry, right? Why is there there is a reason that why we see a boom since 2023, right? And there are huge investments that are being made in this domain, right from private organizations, government organizations. As I mentioned, a lot of AI-enabled devices are being approved without, I would say, too much of scrutiny level, because that is the need of the hour, and we need to get into those as quick as possible, ride the tide. Right, but GenAI is something which has more nuances as compared to the technologies that we are utilizing elsewhere, and that is why everyone is kind of susceptible right now to introduce it at a larger scale, and that is why we haven't seen too much investments and too much government backing into GenAI backed tools or applications or devices that are solely based upon those. But obviously I see that going in a very good direction with proper rules and regulations in place, proper laws in place, and how you can utilize that. I think it can be propelled very nicely. And it's really near the time that you're talking about. It's really
it's very near.
It's very near. I mean, who would have thought, if you just scroll back your memory lane to 1.5 years, who would have thought that you will be discussing all of those things?
Yeah, that's
It's kind of
that's amazing, to be honest, to think. It's also scary.
It is.
Watching, having grown up watching movies like Terminator and iRobot. That's become the reality now. It's very scary. We are quite a few dates late from when they predicted will happen, but we are getting there. And it's just an acceleration point at this point, right? Okay, let's see how smart we are in handling this boom. So that's been our podcast for today. Thank you for watching. Thank you for staying till the end. We have many amazing podcasts coming in. We have a blog page that will have a summary of this chat that we have. If you would want to read it as a quick cliff notes, you can check that out at www.geekyans.com/blogs. And thank you for watching once again. Do hit the like, comment. If you have any questions, we will be happy to answer them. And do hit the subscribe button so that you are notified of the next episode. Thank you, everybody. That's been GeekyAnts Podcast. Thank you for listening. Bye-bye.